Well, first point, we'll try finally, and I'm calming myself. I need to be calm to express all this, because we are speaking about all the pain and the problems children are having their own families or at schools because they are LGBTI. First of all, you must understand you have a lot of minority groups in the LGBTI groups. A lot of lectures we use to speak about lesbians, bisexuals, gay, but also transgender, intersexuals, asexual, agender, queer questionings. And those groups are completely different one each other. You cannot really think lesbian problems have the same problems than intersex or transgender in their own life, their whole life. And the second things you'll try to do to help yourself when you are with an adolescent or a child and you don't know how to, if he or her is or not an LGBTI person, that to be LGBTI means 4 different ways to be. So you must do and ask about their body at birth, because 1% is not male or female, 1% is intersex at birth, and which is their gender identity. Gender identity means 2 things: who's in my body, a male, a woman, or a non-binary person. And the other questions about identity gender is what kind of body I would like to have. If child, evidently any change must be done, but in the adolescence, this problem is begin to be posed by adolescents themselves. And the point is, what kind of body I want to live to be myself. And those the group of transgender or gender variant, if you are speaking about children. The other point is gender expression, which is your appearance. Are you masculine? You are androgynous, you're feminine. Are you effeminate, or you are a masculine woman? And the last one, the most representative, because the biggest group is the sexual orientation differences: lesbian, gay, bisexuals. Are you oriented to have sex with the opposite sex, same sex, both sex, also with intersex or transgender people, or with nobody? All these passes are completely different one each other, and you all try to ask to any child, because if a child has an anxious depressive problem or is trying to cause harm to him or herself, they could be LGBTI, and they are maybe not telling to you if you are not asking them. You cannot know at all if they are, if you don't ask separately those 3 questions, 4 questions, all of 5. Sex at birth, male, female, intersex. Do your gender is congruent with your sex at birth? Yes, like majority, or not. So I'm gender variant. Which is your appearance? This is something you see. This is not something to ask. Did your sex, this is for adolescents, evidently. Would you like to have sex if they still didn't have? With opposite sex, only same sex, etc. And who knows about your sexual identity? Because this is another problem. The privacy must be guaranteed to the children. This question must be done without parents. And eventually you must know if they also say this to the family, or help them to say that if this is something they would like to do, remembering that coming out is something that could help them if the family could support their coming out. And this is something very hard if the family could not support their coming out. In this case, you must be very, very, very careful, because you could be the cause of violence in this on these children. What you also have quickly to remember, that we are born with a specific gender orientation, gender identity, and sexual orientation, and gender expression, because this is something that happened. This is very hard to explain, that this is something that happened for epigenetic reason, especially during the 3rd trimester of the pregnancy, when we have all of our sexual orientation. Whatever is your sexual orientation or your gender identity is something that has been built in this case, in this moment of the pregnancy of your mothers, and only on your body, if you are male, female, or intersex, has been done always for epigenetic reasons here in the 1st trimester. But born this way doesn't mean anything if at the same time you must confront social storytelling and familiar storytelling, and you must decide if to perform your sexual identity openly or conceal it at all during your life. And is this clear to you, or you are still confusing? Can we continue? And what about children? They could be confused themselves in their mind, because if it was a little bit hard to you to understand the difference within lesbian and transgender, what about words like demisexuals or pansexuals? Also more complicated to you. But also for children could be very hard to pose themselves on this axis. You could use these questions I let you see before also to help them, because if they live into a place where they have been learned to be only one kind of man, only one kind of woman, they could be really in trouble to recognize themselves as lesbian or transgender. And you could help them doing this question, and those persons that still doesn't understand themselves are said questioning, because they are questioning about their identity. Another problem is maybe they are bisexuals, maybe they are non-binary, and non-binary identities or bisexual identity are more difficult to be recognized. Or maybe they are just effeminate or masculine or androgynous, so they confound their appearance with their gender identity or their sexual orientation. The coming out is a very complicated moment, not only in yourself, but only with your eventual partner, with friends, with your family, with institutions, and with the law of the country you live. But this is also, as you see, circles that are embracing themselves, or they can harm the circle down them. That's why family is so high, because family is a very important place. The family could really help LGBTI children, and the opposite could be one of the most strong harming moments to them. And there are a lot of roadmap to the LGBTI mental health, because the consequences of all those trauma are eating disorders, depressions, and risk of suicide. You must understand this better. Looking at this scheme, there is no differences in LGBTI people about schizophrenia, bipolar disorders, obsessive compulsive disorders, or similars. There is some difference for transgender, for ADHD, autism, and personality disorders, but somebody is questioning if it depends on how you prepare you asked if they were or not. And because transgender expulsion by family and society is similar to autism, ADHD, and personality disorder symptoms. So it's very difficult to understand if this is really a problem for transgender persons, or if this happens because of the expulsion of transgender people. And the opposite, there is a very big difference, and it is caused by minority stress, which means the old violence they had during their childhood, adolescence, and following, and moment you can see if you say them later, or about coping. Anxious depressive pathologies, eating disorders, attempted suicide, and effective suicide depend on minority stress. Coping is the cause also for smoking, atheism, and drug abuse, because some LGBTI group depends from those to be easily to know each other, to stay into a group, and also to defend from all the pain you had because of the violence you have in your family, at school, and to drug or drink too much or smoking earlier than adults is a way to become more adult and also to become more happier for a little while. The only things I would like also to stress here, and you must remember that doesn't gender, but sex at birth is exactly the cause to differentiate between effective suicide in LGBTI people also. So XY are risking effective suicide also if they are transgender women or effeminate, and if they are born XX, they are more often doing attempted suicide and non-suicidal self-harm. Do the house are safe places for children, or places where minority stress dwells like any boogeyman? Let's see each group, each problems during the childhood. Sex at birth. If you are into sex, what problems you could have? Did you know this? Well, intersex at birth are recognized only like male or female, and surgeons are mutilating their body to transform them into the real man or the real woman they are not. And this is a big problem. We are asking to stop intersex mutilations. Italy didn't do still at all any speech about this, any movement about this, but a little bit about the interested intersex people themselves. But any law is asked. In Germany, at the opposite, they recognize the third gender. Other countries too. In the intersex is the group in this case is specifically for intersex at birth, but eventually in a second moment, anybody could use the same third gender if they are non-binary persons. Also, non-binary person could be recognized with the third sex, with the third gender. But the most important is at the birth to avoid intersex mutilations. What about transgender or better gender variant children? In Italy, we have infotrans.it. It is also translated in English if you want, with a lot of information about these persons. The most important thing to remember is that in 2020, the WHO changed the manual about diseases and eliminating the pathologies, the psychiatric the diagnosis for transgender people. You only have the non-psychiatric gender incongruence that is useful only for endocrinologists and surgeons when they must change the body and give hormones. But what about children? Do the children are really safe? They are at the center of the battle. Which sanitary systems really protect them? Do your country permit triptorelin use or estrogens at early age, or breast surgery at early age in adolescents, evidently? Or they protect them at school? Third question was the appearance. There's also a group of persons that since childhood have a big problems. There is this big study to show when a father or a mother recognizes in his boy an LGBT person, and what means because of his effeminacy, they are evidently having a different way to contract their boys, and this is having a consequence into a worse mental illness at a very young age, because this study is done with son of 9, 10 years old, and those child are already with mental illness. And the most mental illness, including anxiety, the anxiety is bigger when your parents understand because of your effeminacy you are an LGBTI person. Last question was about your sex. Well, just a little bibliography. The first psychoanalysts that worked about this argument was I say, writing is being homosexual, always speaking about gay men. Most part of the works are about gay men. I'm sorry, but this is the reality. The men are at the center of everything, also about LGBTI studies. And this is a very important study because it represents how the childhood in psychoanalysis, how the childhood of gay child is completely different, is the cause of the bad behavior of their own parents against them. Well, other arguments are the adverse childhood experiences. I will not explain you what they are, you must know, but you can easily see that physical, emotional, and also sexual are more often victimizing LGBTI people. Sexual because sometimes lesbians must suffer of rape, corrective rape from their own family. But you have also a secondary experiences like bullying, poverty because you have been expulsed by your family during your adolescence or before, peer rejection at school, experience of racism in your family, community violence, food scarcity because you were expulsed by your family, experience of the care system that in the countries not always are helping LGBTI people, poor academic performance because you were expulsed also by school because LGBTI. And evidently in this study, they show that LGBTI, in this case lesbian, gay, bisexual, have more ACE score than heterosexual people. Another important thing in Canadian study is that we often, since adolescence, a lot of LGBTI people are living in a shelter or in the street without a community. But at the opposite, we are living more often with our family because we didn't have scholarity and we don't find any job. And this is giving us we must stay with our family. But this is also a problem because to stay with a homotransphobic family means continue to have a violence all life. And also, this also very evident. LGBTI people could be very rich, but they usually are more poor than heterosexual people. The importance of family, of support. Very little in the studies are the family that helps their own child, but this is very important. The positive childhood experience, because also apart the adverse, you also had the positive childhood experience, all of them could be used to help LGBTI children to reduce or to avoid familiar or scholar violence. 50% of youth who were enrolled in middle high school reported being bullied also before the high school. There are, in America, in USA, programs about paying LGBTI in school, LGBTI inclusivity in schools, and studies that show how LGBTI people are receiving, also at a very early age, like 10, more bullying before suicide, risk of suicide, evidently non-effective suicide, than any other group. But exactly the children at school are at the center of a war, an international war. One side asking to protect, especially trans kids, and opposite side, people using their own child to say, let kids be kids. But kids are not only male, female, and straight and cisgender. Kids are also born LGBTI. LGBTI cyberbullying is another problem. It's another place where, especially this generation of child that use better than us internet, are suffering of violence. And you must remember that a lot changed about coming out in the different generations. Me, I am here in the middle, and older people than me did their coming out very late. The youngest are coming out very early in their life, which means also that suicide risk, confronting with familiar expulsion or with familiar in school, bullying and violences, are arising their suicide risk, because we don't risk the suicide because we do coming out or because we are LGBTI, but because of the violence we must suffer in family or at school. So we must study at that point what is affirmative psychotherapy. You're supposed to study again back because anybody lets you study it at all. And you must help me to build a network to teach affirmative psychotherapists, so everybody, or from the university studies. This is an Italian book, the only one about this argument. And you must remember that affirmative psychotherapy, here in the low side, is the only one that is quite completely eliminating anxiety, depression, and risk of suicide, not completely alcohol and substance abuse, because those are depending also from coping, not only from violence and minority stress, but also from coping from the LGBTI community. But anyway, this is really reducing it. And the opposite, sojiche, which means conversion therapy. If you try to let an LGBTI people to change in a straight person, this is letting them suffering the most and risking life really, really too much. And the third chance you could think in your mind, because sometimes some specialists think to be indifferent, to be, I treat the same way a gay, a lesbian, or a straight person could be good. Now, studies show us that it's not good at all. If somebody is an LGBTI person and you could not know in a child, if you don't ask to all of them with at least three of the 5 questions about gender, about sexual identity, you couldn't really know. The last 2 are, there are different models. Those one are the cognitive therapy, but you also have models in psychoanalytical or familiar relational and other psychotherapeutic models to help persons to do the affirmative therapy, not the indifferent. And please, never try to change an LGBTI child. He perfectly know who he is, or who she is, or who they are. I stay with the LGBTQ survivors. As you can see, in USA, a Center of Family Services is working for LGBTI persons. Here in Italy, and I don't know in other countries, family centers are against LGBTI children's rights. They are one of the biggest causes of violence against LGBTI children. And we must change all of this. And to change all of this, we absolutely need your help all around the world. Thank you very much.